We all know how uncomfortable acid reflux can be, but when frequently left untreated, acid reflux can develop into something much more serious. Terrebonne General Medical Center wants to bring attention to this all too common symptom that can actually lead to ulcers or even cancer. There you have it. As you can see, acid reflux is our topic tonight. Dr. David Pellegrin is our guest. Dr. Pellegrin, welcome tonight. How are you?
I'm fine. Thanks for having me today.
It's been a while since I've seen you, but of course a lot has been made about acid reflux, and we see all the commercials, we hear all about it, but exactly what is acid reflux?
Well, acid reflux is a condition where the closure between the esophagus and the stomach is weak. The esophagus is a tube that connects to your mouth and your stomach, and there's a closure there that forms a valve, and it keeps the acid and other stomach contents that are in your stomach from coming into your esophagus, where they can cause damage, and it can also cause symptoms such as heartburn.
Like other, I guess, conditions, are there different kinds of acid reflux that you have to deal with?
Well, sure there is. First of all, there's regular garden variety heartburn. Everybody has heartburn from time to time, depending on how they eat, whether they exercise right after eating. Also, sometimes when you're under a lot of stress, you can get symptoms such as heartburn. But there's also a condition called gastroesophageal reflux disease. And these are people who experience heartburn regularly more than 2 days out of the week.
Okay. Now, the causes of acid reflux, what would they be?
First of all, the most common cause is things that cause a weakness of that muscle between the esophagus and the stomach. The first thing that can cause that is what's called a hiatal hernia. A hiatal hernia is where the opening in the diaphragms, which is a big muscle that separates your chest from your abdomen, is too large. Normally the esophagus passes all the way through that opening, but when you have a hiatal hernia and that opening is too large, a pouch of the stomach can come up into the chest, making it easier for you to have heartburn.
All right.
Next of all, sometimes that muscle just relaxes on its own spontaneously. It can be normal most of the time, but then it just relaxes and allows acid to come up. Pregnancy also commonly causes heartburn, and any lady who's been pregnant knows they experience much more heartburn while they're pregnant. Obesity is a very common cause of heartburn. Use of cigarettes and alcohol can also cause quite a bit of heartburn as well. There's an unusual condition called scleroderma. It's a connective tissue disorder that actually damages the muscles in the esophagus, leading to rather severe heartburn and complications. And there's even a more unusual condition called Zollinger-Ellison syndrome. And in that condition, you form small tumors around your pancreas that produce a substance called gastrin that cause excessive amounts of acid to be released by the stomach, resulting in heartburn. Also, infants can very often develop reflux. It commonly occurs after feeding and with crying and other strenuous activities that infants do. And that normally resolves on its own by the age of 12 to 18 months.
I didn't realize they had so many causes, but I guess that's why you're here for sure. The symptoms of acid reflux, does it vary in different people, and what are they?
Oh, there are many symptoms associated with acid reflux. The most common are a feeling of heartburn or indigestion, or it feels like your food's trapped in your chest, and it just it's an uncomfortable feeling. But there are many much less common causes of symptoms associated with reflux. First of all, a person may just experience a lump in their throat. Next of all, patients can have symptoms just like asthma, where they wake up in the middle of the night short of breath and wheezing, and that could be caused by reflux. Mm-hmm. Complications of reflux can cause what's called dysphagia, where a person experiences difficulty swallowing, and that can cause as a result of reflux as well.
All right, what we're going to do, we're going to take a short break and hear from Terrebonne General Medical Center, and when we come back, we'll continue our discussion about acid reflux with Dr. David Pellegrin. Don't go away.
Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
together a crew of top specialists, and you can do amazing things. Cardiac care at TGMC. It all begins here.
And welcome back to Your Health with Terrebonne General Medical Center. I'm Martin False. We're talking about acid reflux, and Dr. David Pellegrin is our guest, and he has been with us for one segment. We're going to move into our second segment, preventing acid reflux. How could I or anyone in the audience prevent it?
There are some things you can do on your own to prevent acid reflux. The first is by altering your diet. You don't have to cut these foods out completely, but it's often best to reduce the amount of fried foods and fatty foods you eat, which can cause reflux. Also, it's best to avoid too much alcohol, which can contribute to reflux as well. Next of all, foods with a lot of acid in them, such as tomatoes, citrus juices, and things like that, can often contribute to reflux.
I knew you were going to tell me that.
Next of all, there are lifestyle changes you can make as well. It's best not to eat too much at one sitting. The more you fill up your stomach, the easier it is for things to come up into your esophagus. Next of all, it's best not to lay down or do strenuous activities immediately after eating. It's best not to wear clothes that are too tight around the waist. That could contribute to reflux as well. And also, losing weight, limiting your use of alcohol and cigarettes can help as well.
So spaghetti, I got to take that off my diet?
Well, just don't overdo it.
Yeah, there you go. All right, now the tests that are available to determine the severity of acid reflux, what are they?
Well, for years and years, we've used a test called a barium swallow or upper GI. It's performed by radiologists, and you're given some chalky substance to drink, and the radiologist watches that substance go down your esophagus and into your stomach and into your small intestines. It can help detect abnormalities in the wall of the esophagus or the stomach, and it also gives us a good idea about how the esophagus and the stomach work. Next of all, there's upper endoscopy. And for this procedure, you're sedated. And after you're sedated, a small tube is advanced into your esophagus and into your stomach. You can detect whether there's inflammation of the esophagus or the stomach with that test, and also biopsies can be performed if necessary. Next of all, there are a group of patients that have symptoms that could or could not be related to reflux, and we want to try to figure out exactly whether they do have acid reflux or not. And the only way to do that is to monitor how much acid is in the esophagus. The most common way that's been done in the past is a small catheter is advanced into the esophagus through the nose and is attached to a recorder that you wear in your belt. And you have to keep that in for 24 hours, and it measures the acid content in the esophagus. It's subsequently downloaded into a computer and analyzed. We had a lot of difficulty with that, and the patients just didn't want to do that test, and they wouldn't eat normally while the catheter was in, and it was hard to tell whether they really still had reflux or not. And now that test is done wirelessly as well. And with that, a small catheter is used to place a device that stays in the esophagus for 3 to 4 days. That sends a message wirelessly to something you wear on your belt, and you bring that in, and that's brought in and put on a computer and analyzed as well. Finally, there are some patients who we need to find out how the esophagus works. Particularly, I mentioned scleroderma earlier. Patients with scleroderma have damage to the muscle of the esophagus, and you can detect that damage by placing a small catheter into the esophagus that can take pressure measurements of the esophagus, and it can see how the esophagus actually works. And that test often is important for people who are considering surgery for reflux, because when a surgeon does surgery for reflux, he tightens that muscle at the end of the esophagus. And you want to make sure that the muscles in the body of the esophagus are strong enough to push your food down past that new narrowing that the surgeon is making.
It sounds like a lot of high-tech advances have been made in this field. So.
Well, and it's continuing.
Good. That's good to hear. The treatments that are available for acid reflux, what would they be?
Well, for the normal person that has occasional heartburn, antacids are the most common things that people use, and they're very effective for that purpose. Next of all, there are patients who have actual true gastroesophageal reflux disease, and there are both prescription and over-the-counter medications that they can use. I would suggest to people, though, that if they're regularly using over-the-counter medications, that they make their primary care physician aware of that, because they need to know that. Finally, surgery is available for patients with reflux. I would have to say the best candidates for surgery are, first of all, young people who don't want to go through the cost and also potential side effects of being on medication for 50 to 60 years, because once you have reflux, you're generally going to have it unless you make dramatic changes in your weight or your lifestyle. Also, another good candidate for surgery is patients who are taking medications for reflux, and it's controlling their heartburn, but they're still having regurgitation where the stomach contents are still coming up into the chest and the throat. And those patients often are helped very well by surgery.
Okay, very interesting. The complications that are associated with acid reflux, are there many?
There are a few. First of all, there's a condition called Barrett's esophagus, and in patients who've had chronic reflux for years, the end of the esophagus can change, the lining can change to a type of lining similar to like what's in your small intestines. And patients with Barrett's esophagus are at increased risk of cancer of the esophagus, and they should be monitored with endoscopies on a periodic basis. Next of all, you can get damage to the end of the esophagus from chronic acid reflux. You can develop irritation, ulcers, and even if you've had ulcers for a long period of time, you can develop strictures which make it difficult for you to swallow. Finally, less commonly, there are patients who develop asthma as a result of reflux, and it's important to find out whether a person with asthma has reflux, and that it can really help control their disease much better.
Okay. Now, if I want to learn more, or someone watching wants to learn more, how can they do it?
Well, first of all, they could call Terrebonne General. The number is 985-873-4141, or go to the website, tgmc.com.
All right, very good. It's been a while since I've seen you, but thank you for coming by and sharing that with us, and we appreciate you coming by, Doc.
Thanks for having me. Thanks a lot.
All right, once again, Dr. Pellegrin, and we'll take a break. When we come back, we'll be in the Canada's kitchen, so remember, we'll go there, but they can't cook with tomato sauce because it might cause acid reflux, so just joking. We'll be right back.